check this out, guys. Here's the meds I'm currently taking right now. I'm sitting here with the legendary Dr. Esselstyn. I've been following his diet 2 years since my heart attack, and we're going to go into finding out what happened, who is Dr. Esselstyn, and how can he help you. So let's find out. Dr. Esselstyn, such a pleasure to finally meet you. Thank you so much, Dr. Esselstyn. So tell us about your story and how you discovered plant-based diet.
Well, that all kind of goes back to the late 1970s when I was chairman of the Cleveland Clinic Breast Cancer Task Force. I became increasingly disillusioned with the fact that for no matter how many women I was doing breast surgery, I was doing absolutely nothing for the next unsuspecting victim. This led to a bit of global research, and it was quite apparent that there were multiple cultures where breast disease was 30 and 40 times less frequent than in the United States. And in rural Japan in the 1950s, breast cancer was very infrequently identified. Yet as soon as the Japanese women would migrate to the United States by the second and third generation, they now had the same rate of breast cancer as their Caucasian counterpart. Mm-hmm. Perhaps even more compelling was cancer of the prostate. In the entire nation of Japan in 1958, how many autopsy-proven deaths were there from cancer of the prostate? 18 in the entire nation. The most mind-boggling public health figure I think I've ever encountered. Mm-hmm. And by 1978, 20 years later, they were up to 137 compared, which really is minuscule when you compare it to the 28,000 men who will die this year from cancer of the prostate. But what I was really beginning to notice was that in this global research, I continually encountered cultures where cardiovascular disease was virtually non-existent. And then it became apparent that perhaps there would really be more bang for the buck if we could get people to eat in a way that they would eliminate or diminish the likelihood of having heart disease. Mm-hmm. It would also be a great service and help them to diminish the likelihood of having the common Western cancers of breast, prostate, colon, and pancreatic. But you can't just do this with a concept. You have to do it with research if you're going to convince people. Mm-hmm. So that was the origin where I started our first study on people with seriously ill with cancer to show that when they're eating plant-based, they could markedly diminish the likelihood of any disease progression. And we often began to see striking examples of disease reversal. Mm-hmm. So really, when you think about it now, I think you can say that really coronary artery heart disease is nothing more than a toothless paper tiger that need never, ever exist. And if it does exist, it need never, ever progress. Mm-hmm.
Mm-hmm. That's amazing. Just the work that you're doing and what you discovered, I think some people think is very controversial. You know, plant-based diet, can you eat meat? And just to kind of go a little bit more into depth, what is it exactly that you would say people should avoid, like the meats? You say this all the time, what meats to avoid, and then what should you be eating?
Well, when I'm counseling patients, I like to try to steer away from concepts that are too complicated or difficult to understand. Mm-hmm. And I think if we reduce coronary artery disease to its most common denominator, I like to have patients try to understand that when they are eating the Western diet, what are they injuring in their body every time they do this? Where they're injuring the delicate innermost lining of the artery, the endothelial cells. Why is that key? Because the endothelial cells manufacture an absolutely magic molecule of gas called nitric oxide. And it is nitric oxide that is responsible for the salvation, preservation, and protection of all of our blood vessels because of the remarkable functions that nitric oxide possesses. For example, nitric oxide will keep all the cellular elements within our bloodstream going smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number 2, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. Number 3, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed, and protect us from getting high blood pressure or hypertension. Number 4 is the key. A safe and normal amount of nitric oxide will protect us all from ever developing blockages or plaques. So literally, everybody on the planet Earth who has heart disease has their disease because in the previous decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into an absolute train wreck that they no longer have enough nitric oxide to protect themselves from making blockages and plaque. However, the good news is this is not a malignancy. It's a completely benign foodborne illness. And once you can get patients to understand that never, ever, never, ever are they to pass through their lips a single morsel that is going to further injure an already train-wrecked endothelium, because then the endothelium will recover, make enough nitric oxide so we can halt any disease progression, and we often see elements of disease reversal.
That's exactly right. I hope you guys are paying attention. This is some pretty good stuff. So some of the questions my audience wants to know is there's so many common foods that everyone always asks about, and I'll list some of them, and I'll tell you exactly what they say. Okay, I won't eat steak and lamb, but like, what about fish? Fish is good for you. Fish has good fat. And second thing, I want to put some avocado on there and put some olive oil. How about those 3 items that everyone keeps asking me about?
Well, the things we really want people to eliminate are the foods that injure the endothelial lining. And one would be any oil. Get rid of the oil. It injures the endothelial lining. Also, get rid of meat. That is, meat, fish, chicken, fowl, dairy. I mean, we got the dairy in it. Well, yes, dairy has to be included as one that has to be omitted because when you think about it, dairy is really a problematic from the standpoint of milk, cheese, butter, dairy, ice cream, yogurt. I'm also a little bit down on sugar. Sugary drinks, Diet Colas, Pepsi and Coke. Also too much in the way of sugary foods, cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey. I don't like peanut butter, nut butters, cashew sauce, avocados, and coffee with caffeine. Once we get rid of those foods, you really have gotten rid of the foods that are going to injure the endothelium, and it begins to recover. And as it recovers and you make more nitric oxide, you really have got all your natural protection improved. Interesting.
That's really the big question is why. Well, what does nitric oxide do to your arteries? But more importantly, when people say, but salmon is good, salmon has good fat, bad fat. What do they mean, good fat, bad fat? Isn't fat fat? You don't want that in your body.
I mean, you can injure yourself with fish. There's an interesting study. I believe it was Ansel Keys who looked at autopsy studies of those living in Iceland who were largely thriving on seafood, and they're loaded with cholesterol, and they're loaded with vascular injury. So that really it's you can't get healthy eating fish. And nowadays, of course, with everybody has said that the ocean is almost like a sewer. So you're growing the fish in really an unfavorable environment.
And what about the omega-3? But fish has omega-3. Where am I going to get omega-3 from if I'm vegan?
Omega-3 you can find certainly easily flaxseed meal, chia seeds, green leafy vegetables. And if even with that, if you feel that your omega-3 level is not adequate, there is omega-3 alpha as a way to get an additional supplement.
Mm-hmm. What about the other vitamins like B and K and all this stuff? Do you need to take vitamins if you're fully plant-based?
Really, if you're eating a well-rounded plant-based diet, other than B12, I would encourage people to take B12 because although the human can barely make some B12, I think that would, we want to be sure to cover that. And it's interesting when you think about eating a fish source to get B12. Where do the fish get it? From the algae.
Mm-hmm. And you're consuming that. So that's why people, even though you're asked all the time, but can I still have fish? There's your answer about fish. So then we'll go into what can you eat, and maybe specifically, what is Dr. Esselstyn's diet?
I have something you can eat.
Yeah, there we go. Anne's got something for us. So
I'm bringing it right now.
Sure.
Cut it out.
No, that's fine. You can keep it rolling. It's
You can
okay.
cut this out.
What do we have here?
This is kale with a little balsamic vinegar.
Okay. Maybe Dr. Esselstyn
6 times a day.
Maybe Dr. Esselstyn can explain why kale with balsamic vinegar. Let's talk about that while I take a bite out of this.
Well, I think one of the changes that I made about a decade ago in our program came about because of an appreciation of the fact that the endothelial production of nitric oxide is age dependent. Mm-hmm. For example, you never heard of a boy or a girl at age 8 having a heart attack. No, they have nitric oxide coming out of their ears. But by the time they're beautifully healthy, at age 50, they now have 50% of the nitric oxide they had when they were age 25, and by the time they're 80, they lost 70%. So the changes that I made about a decade ago I think they were rather important because one was a greater stimulation of the endothelial production of nitric oxide, and the other was an appreciation of the fact that research has shown us that there is an alternate pathway for medicine, an alternate pathway for mankind to make additional nitric oxide. So let's do it. I need patients to ingest 6 times a day a green leafy vegetable, roughly the size of 1/3 of a cup, after it's first been steamed or boiled 5.5 to 6 minutes so it's nice and tender. Then they must anoint it with several drops of a delightful balsamic vinegar. Why? Because research has shown us that the acetic acid in those vinegars can restore the nitric oxide synthase enzyme found within the endothelial cell that is responsible for making nitric oxide. So they're going to chew this alongside their breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich. That's 3, mid-afternoon 4, dinner time 5, and of course I adore it when you have that evening snack of arugula or kale. Now the second benefit, when you're chewing the green leafy vegetable, you restore the capacity of your bone marrow to once again make the endothelial progenitor cell. What does that do? The endothelial progenitor cell replaces our senescent, injured, worn-out endothelial cells. The third benefit, when you're chewing a green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce the nitrate you've been chewing to nitrites. When you swallow the nitrites, it is your own gastric acid which further reduces the nitrites to more nitric oxide. Now think about it. What you're doing for minimal expense, no side effects, all day long, dawn to dusk, morning to night, you are ingesting nitric oxide, the very molecule, the deficiency which gave you this disease in the first place. Now there's a caveat to this. Toothpaste with fluoride, public drinking water with fluoride, and mouthwash will injure the beneficial bacteria in your mouth, and I do not like antacids because antacids will decrease your gastric acidity and you will not have enough acid to reduce the nitrites to more nitric oxide. And the top 6 vegetables would be kale, Swiss chard, spinach, arugula, beet greens, and beets.
All full of nitric oxide, everybody. That's what you want. To go back to the toothpaste thing, which toothpaste do you use if you don't have fluoride? You use Crest?
Well, there are multiple ones over the
Sensodyne?
over the internet that you can find that don't have fluoride.
The fluoride is what helps kill the cavities or something like that, enamel?
Fluoride is a bit of a rascal in having this approach to make additional nitric oxide.
Interesting. And then mouthwash, because I have these arguments with my dentist all the time. I'm like, I don't know if I can use this toothpaste. He's like, it's fine. Just keep using it. I'm like, well, what about my nitric oxide? So Listerine mouthwash, no more Listerine. You got to replace it with
mouthwash is out.
Okay. No mouthwash.
When you start destroying the healthy bacteria in your mouth, this is when these problems arise. I tell you, the man who has done most of this work is Nathan Bryan out of Texas.
Maybe somebody will have on the documentary, because brushing your teeth with fluoride is what every dentist recommends with mouthwash.
I grant you there is a conflict there. Recently, I think that it also has been addressed by Michael Greger, who has done an interesting presentation about some of the problems of fluoride.
Okay, good to know. That's actually something very interesting. I'm going to stop using Listerine today and switch over from.
Well, I think I think there was some work by Nathan Bryan that's showing that people who regularly use wash and mouthwash and destroy the healthy bacteria have a higher rate of hypertension.
Interesting. That's very powerful what you just said, Dr. Esselstyn. I hope you guys are paying attention to that. So let's go into the actual foods, and let's say your actual diet that your beautiful wife makes with you every day. What do you do in the morning? What are you eating in the morning? People usually like bacon and eggs and all this stuff, but I already know what you guys like. So what do you typically eat in the morning, or you suggest?
I think since she's here, let's let Ann tell you what that is.
You do it. You say what you eat.
Well, what's the favorite food in the morning?
My favorite breakfast, of course, I like oatmeal. I don't like it cooked. I just eat it raw, but I wet it down with a healthy plant-based milk. I also like a few raisins, not many, maybe a banana. And I think it's terribly important to get the berries in. So usually it's going to be blackberries, raspberries, strawberries, and certainly blueberries. And that's, to me, absolutely a delicious breakfast. For the patients who find that sometimes when they convert to plant-based nutrition, they're having a difficult, challenging time holding their weight, if you can get those patients to eat this breakfast at 6 a.m., and then when they get hungry around 10:30, they can repeat it. And suddenly it's still absolutely delicious, it's still nutritious, and they get the additional calories they might need to keep themselves from losing weight any further.
But why oatmeal? Is it because of the beta-glucan, the bile acid secretion? It helps, prevent the cholesterol. Why is it specifically oatmeal?
Doesn't have to be oatmeal.
Anything else alternative to oatmeal? What else could you have in the morning? Because I've been eating oatmeal for the past 2 years straight. Exactly.
That's fine.
Steel cut, and then sometimes rolled oats, even though it's a little bit of...
Yeah, you're going to have shredded wheat.
No, you can't. You've got to have oats.
Oats is the only way to
Oats have
go.
got more
Oats-
power.
It helps to help lower your cholesterol.
Because of the bile acid and cholesterol, the way that oatmeal is metabolized in your stomach. Is that why oatmeal?
It lowers your cholesterol. We won't dig into that.
Okay. Well, everyone's been on oatmeal. I've been on that for a long time. And then you mentioned some raisins, bananas. Those are okay, even though bananas, if they're very ripe,